A very good afternoon. Or you can see this is a chronic non-healing ulcer. Chronic non-healing ulcer. I can see this is a venous ulcer actually. And here you can see that generally the venous ulcers are most commonly situated in the just above the malleolus. But here case is different. We are seeing the venous ulcer which is just below this medial malleolus itself. And you can see these are the here you can see this one, the blowouts of the varicose veins. So these are the blowouts or the swellings which you can see. These are the blowouts of the varicose veins. Here also blowout, here also blowout, here also you can see. This is the great siphonous vein which is running like this. So here starts from here it is, and it goes just beside this one, and here this is a great siphonous vein which is moving. So this is a great venous varicosity which you are seeing, and this is generally in the chronic cases, in the long standing cases of the varicose veins. You will find a complication of this varicose veins to be the ulcers. So these ulcers are called as venous ulcers. So here what we did is we applied the Jaloka, which is a leech, directly over the wound itself. So you can see actually the wound was having somewhat the things which was not at all so clear, not at all tidy wound. It was having some of the slough, and also you can see the base is not at all clear, not at all having the granulation tissue and all. So we applied the Jaloka here. So 2 Jalokas has been applied here. This is called as the leech therapy in the chronic non-healing ulcers. So how this helps me is generally this leech sucks the blood which is present here, but it gives some of the chemicals directly over this part, so that there is micro circulation improves. The improvement in the micro circulation will be seen, and also you can see the new blood vessels to be formed, which will help to heal the wound very clearly in a very short time. So as a complication of this varicose veins, this ulcer is seen, so it is called as the venous ulcer, and also, or it is also called as the varicose ulcer. And also in case of the varicosity also, where there is a discoloration, you can see the discoloration here, hyperpigmented marks over here, multiple sites are there for having the hyperpigmentation sites. So here also we can apply the Jalokas so that we can have the good effect to get relieved from this hyperpigmented area which is dark colored skin. This can also be removed. Generally we apply the Jalokas for the veins, for the venous diseases, so that we can see the clarity of the skin as it removes out the pitta doshas, and it also helps in wound healing, right? So this is a case of the varicose ulcer or a venous ulcer. So you can see the Jalokas have started sucking. Catch on the light. You can see the Jalokas are sucking the blood. So subcali mode. One side you can see this is the, and you can see the edges are not at all so clear, but still having some of the stubs and all. This is the mouth of the Jaloka, this is the mouth of the Jaloka. 2 Jalokas we applied, and this is the base of the Jaloka, which is just used for holding they will just hold the things for the stability. And you can see the sucking of the blood. So you can zoom it out so that you can see the sucking part, how it sucks. You can see the movements of a small things at the mouth part. Thank you. We'll just applied it. We will wait for about 1 hour or 48 minutes, or till the Jaloka leave the site on its own, and then we will just do the dressings, and we'll repeat the session, this setting of this Jaloka again after 1 week, or generally we ask the patient to come for about 5th day or 7th day, and after that again we will apply. Generally the required settings are about 3 to 5 settings are needed for this wound to get healed completely. and generally within 4 to 5 weeks, just we can expect the healing of the wound, right? So there will be a small layer which is the epithelialization, will we say. So we'll see the epithelialization over this part, and then after the epithelialization, generally the infections will be reduced. The infections will not be seen after the epithelialization, and after that we can expect the healing. So here you can see this, the vein, the varicose vein. Thank you.